Good morning and welcome to the 21st in our series of special webinars about the challenges North Carolina is facing as we react to COVID-19. I'm Pat Cronin with the Institute for Emerging Issues, sitting in for Leslie Boney. Today we have the last in a series of 3 episodes looking at the impact of COVID-19 on childhood development. Our thanks to the Duke Endowment for sponsoring this work. Last month, we looked at parenting education programs, how they're teaching thousands of parents across the state key skills when it comes to promoting the health and education of their children. We heard how the people teaching these programs are pivoting in important and effective ways to continue to deliver these services during a pandemic. And we also heard loud and clear that access to parenting education is something that all parents can benefit from. Unfortunately, only a small number of parents are able to be served at current funding levels. 2 weeks ago, we discussed the importance of childcare to our economy, to parents, to employers, and to those who work in the industry itself, the so-called workforce behind the workforce. As the pandemic hit, many childcare centers closed while others remained open to serve working parents. We heard how the pandemic has inflicted a disproportionate burden on the heavily female and minority childcare workforce that finds itself either out of work or having to risk serious illness in order to bring home a paycheck. All of our panelists agreed that the pandemic has made clear the economic importance of high-quality childcare. We must, as a state and country, figure out how to offer it to all children at affordable prices. Recordings of both of these programs are on our website, emergingissues.org/podcast. And now to today's episode. When the pandemic hit in March and we moved toward sheltering in place, there were grave concerns about the traumatic impact that this would have on children and adults alike. One prediction was that we would see a dramatic increase in child abuse and neglect as financial and other pressures built up and then exploded in households across the country. Looking longer term, other experts predicted that many children, perhaps a whole generation, would be profoundly traumatized by this experience. And this trauma would impact them their whole lives in lower educational attainment, poor employment prospects, and serious chronic health issues like high blood pressure and heart disease. Well, we're now 5 months into the pandemic. And if a pandemic was not enough, we've also seen nationwide protests against the killing of Black citizens by law enforcement officials, another potential source of trauma. Have these predictions come true? What do we know about the impact of these events on child trauma? And what can we do long-term to support all children and families when it comes to trauma? Well, here to talk about these questions are 3 distinguished guests. In alphabetical order, we have Sharon Hirsch, President and CEO of Prevent Child Abuse North Carolina, a statewide organization dedicated to preventing child abuse and neglect before it occurs. Jennie Kristiansen, Director of the Chatham County Department of Social Services, and Dr. Charlene Wong, a pediatrician and health policy specialist at Duke University. During the show, we welcome your questions and comments. Please use the chat function in Zoom or comment on our Facebook page. We'll try to get to as many of these as we can over the next hour. If you're commenting in Zoom, please use the all panelists and attendee option to submit your comments, so everybody watching this show can see what you are interested in, and also respond if they feel called to. Let's start with the prediction about a more immediate increase in abuse and neglect. Ms. Kristiansen, let's go to you first. What have you been seeing in Chatham County when it comes to abuse and neglect?
Well, when the pandemic first hit, we were concerned because we really did see a drop in the number of reports of abuse and neglect that we were receiving. And so for the months of March and April and May in particular, we were trying to figure out what the best way to reach people was. And so we were fortunate that our local newspaper ran a couple of articles, and I do think that helped. We were trying to just make connections in the community where we could, make sure that people knew how to get in touch with us, even though we weren't, our offices weren't open to people walking in. Typically, abuse and neglect is reported to us over the phone, though. And When we went into June, our reporting numbers doubled. And then in July, we were kind of back to an average number of reports every month. So we did see an initial drop. And now I feel like things are starting to pick back up again, and we are getting reports.
So the predictions were we're going to see a big increase. You saw a drop, though. There's a reason, right, for why you may have seen that drop.
Yeah, we know during the summer we tend to not get the same number of reports that we get during the school year, because the schools do interact with a lot of children in our state and tend to report things to us. And so since school was closed, our reports weren't coming in at the same rate. And so, so you knew that people were under a lot of stress and under a lot of pressure. And so you knew that was still existing, but you weren't getting called when things began to escalate. And so we were definitely concerned about that, feeling a little bit better now. And also thinking that once we're also anticipating a surge of reports probably when children do go back to school in person.
Okay. So this has to do with the issue of who reports, right? Many of the cases of abuse and neglect. And I think we have a slide, if we can put that up. It, in fact, isn't the case that most of the reports, the vast majority of reports come from professionals, right, that kids interact with on a regular basis. You mentioned schools, right? Educators, over 20% of the reports come from educators, legal, law enforcement, social services, medical providers like Dr. Wong. When we go into the lockdown, right, all of a sudden kids aren't seeing those folks, are they?
Right. And so when we were looking at some of our data, we shifted from education and law enforcement being some of our more frequent reporters to law enforcement and community members being some of our more frequent reporters.
Okay, good. Thank you. Well, Dr. Wong, what are you and your colleagues seeing at the patient and community level when it comes to abuse and neglect?
Yeah, we're seeing a lot of stress. We're just seeing a lot of stress and behavioral issues, certainly in young people, as well as in their parents and caregivers and families. And we know that whenever stress and mental health, behavioral health issues are rising, that just puts children at even more risk for abuse and neglect. The social and economic upheaval from the pandemic has just been so substantial. And the other thing that we're really seeing is really just the inequities and how inequitably distributed the burden of the pandemic is, and also the risk for abuse and neglect, either for children. We've been doing some proactive outreach, for example, to children we know are at risk. For example, those children who have been seen in our child abuse clinic. We started that very early in the pandemic because, like Ms. Kristiansen said, we were anticipating seeing that surge. We did anecdotally, she has, better sort of countywide data than I have for, being at Duke. But we certainly anecdotally heard some really horrific stories early in the pandemic. I would say what we're also seeing, when seeing our patients and families now is it's a marathon. It's truly a marathon, for families who were hoping that they'd be coming back to work. And we sort of see that we've still probably not gotten out of the first wave. We're very much trying to prepare for, and we're very nervous about a second wave if we get out of the first wave. And then I think with the back to school, and as Ms. Kristiansen alluded to, the stress that we're seeing on families who are having to try to work, supervise their remote learning children, particularly for those children who are younger, who already had special learning needs before this started. I'll just give one anecdotal story. One of my colleagues saw a single mom who works overnight and came in for her child's well-child check and was crying because she said, and she has two children who are in elementary school, and she said, I don't know if, when am I going to sleep? Because what she would typically do is work overnight, come home, drop her kids off at school, and then sleep so that she would be able to, care for them and go to work. And I think there are so many families who find themselves in that situation. And as that stress and fatigue and everything rises, the risk of abuse and neglect just goes up so substantially.
Right. Ms. Hirsch, based on what you're seeing and hearing from others, are the the accounts we're hearing about Chatham and Durham County reflected statewide?
Yeah, we're hearing very similar things from all the counties and communities that we're interacting with. Our real concern is that social connection and financial stress are the two things that are the biggest risk factors for abuse and neglect, even in normal times. And so having this double whammy of folks where folks are losing jobs, they're feeling incredible stress, plus they're socially isolated if they're following the recommendations of all the health providers by staying home, having their kids at home at the same time. It's just compounding all of that stress at the same time. At the same time, we're really concerned, as Dr. Wong said, about the inequities. And we also know that families that have economic supports and have those connections can do better if we invest in those services and programs. So that's where our focus is right now. We're really trying to educate folks across the state about the need to reach out to their friends and neighbors that may be struggling, and for the importance of both advocating for the federal and state level supports, but also giving to your food bank, making a financial contribution to the agencies that support and strengthen families so that we can prevent this from happening.
And we have a question in the chat box, perhaps for you, Ms. Kristiansen. Are there new guidelines in place to help identify abuse and neglect in communities? This would seem to be, I'm assuming this is getting at the fact that, kids are going back to school, but many of them are virtual, right? So are there new guidelines for helping all of us play a role in helping to identify abuse and neglect?
The guidelines haven't changed. Everyone in North Carolina is a mandated reporter, and so that is consistent. And so I think the way in which we're interacting with one another, as we've said before, is different. And so we want to make sure that people know how to, if they have a concern about a child or a family, that they know how to reach their local department. And while I think that's exacerbated by COVID-19, that's always a concern for us, is that people know how to get help and know how to get connected to us when they need to.
Okay. And how do people, Ms. Hirsch, go ahead.
I would just like to add that, as Jennie said, we all are mandatory reporters. And we have a training that is available online for free on our website on how to recognize and respond to child maltreatment. It teaches folks about the signs, and it also teaches how to make a report so that you know how to reach your Department of Social Services or law enforcement as appropriate, or the Division of Child Development and Early Education. And we really encourage all North Carolinians to take that course so that they can be a part of the solution. We also want folks to think about how they can support families first before having to make a report to CPS, because all families don't need a CPS report, they just need help. And as good neighbors and good citizens, we should all be reaching out and being mandatory supporters too.
And I'd like to add to that, if possible. I think what Ms. Kristiansen was saying earlier reminded me of what we're seeing in healthcare. All of a sudden, we're not seeing heart attacks and strokes and new diagnoses of cancer. It's probably because it's not happening. It's just not coming to our attention. As you showed on the slide earlier, physicians, healthcare workers are a predominant and important reporter of concerns of abuse and neglect. We are really encouraging parents and families to bring their children in for their usual checkups, for their vaccines, both because we want to make sure that children can continue to thrive, and because that's the place where we do screen for any issues that might be arising, from abuse and neglect to poor growth to worsening asthma, and making sure that children have all the preventive and acute healthcare needs met. And just to mention, they can do that in person, or we've been able to really accelerate virtual services through telehealth very quickly across the state.
And I'd like to return to the telehealth question in just a moment. But Ms. Hirsch, you want to just give your website address? I know it's been posted in the chat, but for people who may be calling in and not seeing.
Sure, it's preventchildabusennc.org, and you can go to the resources page and get more information about how to access the training.
Okay, and I might also mention you have a very helpful guide for families and caregivers relating to COVID-19 lots of wonderful information about how to, in a word, stay sane, right? But how to deal with stress and the trauma that comes about from this pandemic.
That's right. It's right at the top of the website.
Very good. All right. Well, let's return to something that you all were mentioning earlier, the inequities of the pandemic. And I'll just throw it out to all of you, and you can raise a hand and answer it. But what do we know about which populations are most impacted when it comes to the abuse, neglect, or just the trauma being experienced by the pandemic? Maybe I'll ask Ms. Hirsch. Why don't you just start, and then we'll go around the horn.
Well, we know generally that child abuse and neglect cases are disproportionately among younger children first. So young families that are struggling often early in their careers or in their jobs have more financial stress, and being a new parent is really stressful. But we also know that disproportionately children of color are known to our child welfare system as well. And we've been seeing the same things happen in the pandemic of more families and individuals of color getting COVID, the same kinds of things, I'm assuming, and Jennie, and I'm sure Dr. Wong can confirm this, are continuing to happen with abuse reports across the state right now. That would be the pattern.
Ms. Kristiansen, is that consistent with what you're seeing? And
that is consistent. And, people have asked us about, are you seeing anything different now than you were seeing before? And I think we're seeing a lot of the same families really struggling with some of the same very serious issues, like a substance use disorder, domestic violence, and serious behavioral health issues. And but what's different is that the pandemic has made access and just living our day-to-day lives all the more complicated. And so I think our families who have the least resources and are able to adapt and have work where they have less flexibility are most impacted by the pandemic. And that's concerning.
And so we're talking children of color, lower income households, I'm assuming, given the issue of financial stress. And what about children of essential workers? They seem to be a group that was particularly placed under stress as a result of the pandemic.
Yeah, I can. Oh, go ahead.
No, go ahead.
Yeah. I'll echo that certainly we're seeing the pandemic impacts both for those who are getting COVID, those who are exposed to COVID because of the disruption. If you're exposed to someone who has COVID and the recommendation is to quarantine for 14 days, obviously that's very disruptive for families who, as Ms. Kristiansen was referring to, have often very little financial reserve, very little to no financial reserve to be able to take 2 weeks off of work and be able to still pay bills. So certainly we're seeing that distribution in our community. Particularly hard hit is our Latinx community in many areas of North Carolina. We're just, especially earlier in the pandemic, that's where we were really seeing, particularly among children, many more of our positive cases, the majority of our positive cases in some of those communities. Where also earlier in the pandemic, the messaging may not have been reaching those communities as effectively, though there have been so many efforts to improve that messaging and outreach into the Latinx community because we did see such inequities early on in the pandemic. I also think that when you think about it's a new domain of inequities that are being seen during the pandemic. As we sort of mentioned earlier, it's the telehealth, the virtual services, the online school. We are seeing newly this issue of the digital divide that families are experiencing. So for example, I have patients who we ask, do you have a device to do online school? Can you get online at your house? And it is really just upsetting to hear how many children say that they can't. And even with a hotspot, which I know some school districts are providing, which is wonderful, there are many students who live and children who live across the state who, even with a hotspot, it's not very effective for them where they live. And I've had teens who have shown me their iPhones with a cracked screen, and that's their device that they're trying to use for remote learning. And again, because of the financial stress and the financial resources required to effectively online learn for children, that's again just another inequity that I think we will see continue to widen, and again add so much more stress for parents, particularly younger parents, like Ms. Hirsch mentioned, that is going to put families at higher risk of abuse and neglect, and ramifications, as you mentioned, Pat, that are going to be very long lasting, because this COVID academic slide that we're seeing, many are predicting for some of our young people, that's a slide that's never going to be recovered.
Right. So let's talk about move from just abuse and neglect to the issue of trauma more generally. Dr. Wong, I think you said you're seeing a lot of stress in your patients. Do you have any sense, is this short-term stress, or is this long-term toxic stress that is going to be impacting them long-term?
I think it's different for each child and family. I mean, certainly any child, and Ms. Hirsch and Ms. Kristiansen could speak to this more than I, with their firsthand experience more in this area. Any child who is abused or neglected as a result or during this pandemic, that is going to be a long-lasting impact. I think for some children, they're actually doing fine during the pandemic, and that's wonderful. They have the right resources in place to help them continue to thrive, and they have, their families have a network or have the flexibility to do the things that they need to do to keep their children thriving. And then there's a bunch of children in the middle for whom there probably will be some who have maybe more short-term effects from this. I have patients whose depression has gotten a little worse, whose anxiety has fluctuated. I'm hearing a lot about ADHD as parents and children are trying to figure out how to do remote learning. And it's hard to know if it's really ADHD or it's just that they're being asked to learn in a completely different way, with teachers and parents who are trying to figure out how to do that. So I think there will be a real spectrum, but that spectrum will not be, again, those disparities and inequities that we were talking about. We will see that play out, both in the disparities from COVID, the educational attainment, and the trauma.
Okay. And Ms. Hirsch, earlier you said some of the biggest sources of trauma are economic stressors and social isolation, correct?
That's right.
So it would seem that to Dr. Wong's point about some children being affected longer term and others not, it would really place a premium on our ability, right, as a society to be able to alleviate those economic stressors. What are you seeing in terms of the impact of the pandemic on trauma generally across the state?
Well, I really want to address what we can do about it. And, there are policies that are currently under consideration at the federal level, particularly paid family leave and paid sick leave for parents to help alleviate that stress, that are really, really important, and other economic supports for food assistance and other public assistance programs, even unemployment benefits being extended. That financial stress can be alleviated. And we saw some good things happen at the beginning of the pandemic with the first federal relief package that passed. So we really are strongly encouraging particularly our senators here in North Carolina to advocate for those investments in families. We know that they make a difference. We have seen research across the country that shows when paid family leave is available to families that we see a reduction in infant head injuries. That's a big deal. There's also more investment in the parenting education and home visiting system that we need to see as well. And I really want to echo what Dr. Wong said about the inequities around internet access. I know that you talked about it in your last Zoomcast about parenting education. We're seeing the same struggles for families not being able to access parent education and parent supports through home visiting, really moving towards providing those services online. But right now, they're not available as they need to be, particularly in the far eastern and far western parts of the state. We see the same patterns of inequity where we've got good access to resources in our urban areas, and our rural areas are really suffering.
Yeah, and I wanted to could I comment, because I saw there was a comment in the chat box about with a question, and I would say the digital divide certainly did exist, and it is really just it's exacerbating the existing equities, and in just many more sectors for young people and for families is what we're really seeing. I've heard, for example, for some of my colleagues from juvenile justice, they're also all the sectors are trying to do more virtually, safety checks, and I'm sure Ms. Kristiansen can speak to that. The state and other programs have tried to do a lot with online enrollment for programs to provide food and housing, and all of those services, which are now wonderfully available in an online format all of those new programs available in an online format are going to be less accessible to folks who don't have good online access.
Right, and just for those who may be listening but not looking, the comment and question in the chat box was, it seems what we're saying collectively on the show so far is that families who struggle in ordinary times are also struggling more now. So the disparities are not new, but exacerbated by the pandemic. And Dr. Wong, you were agreeing with that. I'd like to turn to Ms. Kristiansen and picking up on what was just said about our ability to help alleviate the economic stressors. In addition to investigating abuse reports, your office also administers, requests for a variety of family support programs relating to energy assistance, food, and healthcare. I'm just curious, what are you seeing in the context of an increase in, are you seeing an increase in demand, something that might indicate higher levels of trauma at the family level?
We've had some kind of ups and downs. We have another half of our agency where we determine eligibility for major economic assistance programs. So initially, we didn't see a large increase in the number of applications. And then in April, we started seeing an increase. And similar to our abuse and neglect reports, we're now kind of back in our average kinds of fluctuations. And so it's something we've been talking about and looking at and trying to connect between what we're seeing going on in our country and our community and wanting to make sure that people know about our services and can get connected. I think one of the exciting parts about this is that it's really pushed us to look at how can you apply for an economic benefit without having to come in and see someone in our office. And we've had an online portal for applications, and DHHS is expanding that to be able to apply for other programs right now. And so I think that that's a great thing. Ultimately, you want people to come in and be able to apply for this in the easiest way possible. And so having an online option, having an over the phone option, we now have established this Dropbox outside of our office where you can get all of our applications and drop them off anytime you want, night or day, that's secure. Just trying to be creative and thinking about people need to connect with us in different ways, and what's the best way to do that.
Mm-hmm. Can you say a bit more about how your office pivoted, how you're doing things differently as a result of the pandemic and having to work from home, presumably?
Sure. So we have some folks who are in our office and some folks who are working remotely. And so we're trying to do, like I said before, where we've got, if you want to apply on paper, you can come and get an application. We can mail you an application. You can apply online through ePass, and then you can call us too, and we can do a lot of things over the phone. There's been some flexibility in some of our programs and our recertifications. They've been extended, and so that gives people flexibility. They're not having to worry about they weren't having to worry about losing a benefit in the middle of this crisis. And so, again, just really trying to make sure that if someone calls us, they get to the right person and can get what they need and get their questions answered.
And are you doing things virtually now that you used to only do face-to-face? And I'm thinking you get a report on child abuse and neglect, you need to see the child, or maybe there's a case in process and you need to have a meeting?
Yeah, so we definitely shifted. When you think about abuse and neglect, that really did not change. So if you called and made a report and it was something that we felt like we needed to take a look at, that we were always going out to see people face-to-face. We obviously tried to we understood that families were probably concerned about having us in their homes and wanting to make sure that we're following all the guidelines around social distancing and things like that. So we did a lot of planning around making sure we had enough PPE. At this point, we've been able to distribute masks to the people that we're serving as well. And so trying to figure out how to some things needed to be face-to-face. They'll always need to be face-to-face. And that was not changed. And then in other areas, we were able to take a look at what do we really need. We are a very face-to-face organization. A lot of people come into our office every month. And I think that speaks to, if you're worried about something or you're having a crisis, being able to connect with human being is valuable. And since we couldn't do that, we really had to take a look at how we could still connect with people in the safest way possible, which ended up being virtually. So there was a period of time where children in foster care saw their parents virtually. We did. Even though we weren't having face-to-face visitation, we were having more frequent FaceTiming or using other kinds of virtual platforms where people could still see their children and children could see their parents. But even though we couldn't be together, now we really unless there's somebody is ill or sick, all of our family time and family visitation is back to face-to-face. So we're trying to just balance the importance of human connection, and parents and children need to see one another with the risks related to COVID.
Dr. Wong, let me ask you this question. How have you all responded at the practice level to how you would do business normally and then in a pandemic?
How have we not changed what we're doing? The healthcare system, I think, has worked really hard and really quickly to bring about so many innovations that people have been talking about trying to bring into play for many, many years. And it just happened all very quickly because we were sort of catalyzed by the pandemic, catalyzed/forced by the pandemic. Certainly our delivery of telehealth services has ramped up very quickly. Also, for when children and families are coming into our clinic, we have really changed, and any parent who has brought their child in will know that all practices have done some changes because we're really trying to be very smart about how we protect our patients coming in, our staff who is in the clinic, so that we're not part of the spread of the pandemic. And I would say what I think the experience of the state has been and across the country is that those types of mitigation or prevention measures that have been put into place in healthcare settings are largely really successful. I will say the telehealth services that we're offering, we're seeing such great benefits from being able to offer those services. I happen to mostly serve adolescents and young adults, which is a population that in general has a little bit higher no-show rate than some of our younger children. And we have found, again, this is somewhat anecdotal, though I think there's some emerging evidence that this is not just, my experience, but that those types of no-show rates, particularly for some of our really marginalized young people, is actually up because they spend a lot of time on their devices and they're like, okay, well, now I'll just stay on my device and get on with my physician or, the nurse from the clinic. And so that's really wonderful. But again, we are seeing, some of those inequities. We know, for example, that providing healthcare services to non-English speaking children and families it's an extra layer of having to essentially do a three-way call. We are seeing rates across the country of, for example, our Latinx Spanish speaking population is in general not utilizing telehealth at the same volumes that we had seen them when compared to in-person visits. So there is still that divide. And then speaking of that digital divide for families who are living in areas where they really can't get a video. I've had many patients for whom we try to get on video and the signal's just not strong enough, and we end up having to talk by phone. Certainly we know that being able to see the patient, there's so much benefit there. And the final thing I'll say is that I think our behavioral health system has been particularly good and it's really effective to deliver behavioral health care therapy, psychiatric consultation via telehealth. And to see that has been really wonderful because, again, linking this back to trauma and to abuse and neglect, we know that behavioral health, mental health, and those things all run hand in hand.
So, Ms. Hirsch, how well have we done as a state responding to the trauma of the pandemic from your point of view?
Well, that's a hard question to answer, but I think we have done fairly well. We have had really good public education and awareness happen and done that in coordination with a lot of partners. Our partners at the Department of Health and Human Services have really helped us get the message out about prevention. And when they send out our materials, that helps us reach a larger audience. There's been a lot of coordination in the advocacy community, but we can still do, we can all still continue to do more, even though this is feeling like a very overwhelming time for all of our agencies in doing the work differently. I've been really impressed by how well the DSS agencies have responded and adapted, and it's exciting to hear about the ways that those agencies in particular are providing supports to families in in different ways, both virtually or to be able to drop things off at the office. I think we're going to learn a lot in this process of understanding that we can deliver some services differently. And I think this is probably going to change the way we all do business for the long term, not just during this pandemic.
And so one of the questions to your point is what tools are being used to help educate people, to help them understand how trauma affects the brain and the body, and coping strategies that can be used to reset the nervous system?
Well, we have an initiative called Connections Matter, North Carolina, that is focused on educating the general public about the intersection of brain science, ACEs, and protective factors. And that is an initiative that really focuses on the fact that relationships are the biggest builders of babies' brains and the greatest buffer against trauma. And we've been training folks all across the state. We've trained trainers and then in turn other folks across the state, and have reached about 1,500 people so far in this last year. We've now had to adapt how we provide that training in this new environment as well. It's so much better to be able to talk to people in person and make those personal connections. We've adapted that training in particular to deliver it over Zoom. We've now trained a cohort of about 25 trainers who can now deliver it virtually for us as well. There's a lot in that training around using mindfulness techniques, yoga, meditation, and other ways that we can both be aware of the issue, but how we can buffer the impacts of trauma. There are also a number of initiatives across the state. I think there are almost 60 communities across North Carolina that have ACEs, resilience kind of coalitions that have come together over the last number of years. And those coalitions are very well positioned to help educate their communities and help families understand the things that they can do to buffer the impact of all of this. That connection, and particularly for children, a connection to one caring, nurturing adult can make all the difference in buffering the impact of childhood trauma. We know that the research is now telling us that positive childhood experiences can buffer the impact of the negative ones. So the more we can all be connected to one another and find ways to support families that are in crisis and not have to depend on those public agencies, the better off we're all going to be, because as we've been saying all along in this pandemic, we really are all in this together.
And I'll just call attention that a link to your Connections Matter portion of your website has been posted in the chat there. And I'll also put another plug in for your COVID-19 guide that helps families and caregivers deal with the effects of trauma there. I'll also say when we post this recording tomorrow, we'll have a couple of other links listed there, including one to Sesame Street and Communities. They have a COVID-19 portion of their website with lots of very helpful Sesame Street videos on how you interact in a family context with children around the issues that are arising as a result of the pandemic. So that's another resource as well. I want to return to Ms. Kristiansen, and we were already sort of unearthing things that seem to be unexpected positive benefits coming from the pandemic and how we respond to them. So Dr. Wong talked about telehealth seems to be coming into its own, telepsychiatry in particular. And she mentioned how that with that particular later teen age group, that they are used to phones, so this was fine for them. Are you seeing the same thing in your interactions with children?
Yes, I mean, I think everybody's a little bit different, right, in how they like to connect with others. But yes, this has forced us to look at those kinds of questions, and so we have had some successful stories of people really, like I mentioned before, foster parents and kids really being able to see one another more regularly because they are doing a virtual call, maybe 3 or 4 times a week, whereas before they might see one another 1 time a week. I think that's a positive. One of our social workers was working with a mom and a child who were living outside of our county. And so they were able to have a virtual visit, and that parent was able to kind of show her around where she was living, and she was able to see how everybody was doing. And normally that would be something we would ask another county to have us to have one of their staff come out and meet with that family, and that would be an unfamiliar person to them. And so she really felt like that was a positive, and she was able to have a better sense of how things were going and maybe what some of their needs were, and than if she had just read somebody else's notes from that connection. And so I would agree, we're seeing, a lot of similar benefits. There are times that we just need to be face-to-face, particularly when there are issues around safety. And so that's not changed, like I said before, but yes, definitely pushed us to be creative quickly.
I want to segue and talk about, in our remaining time, talk about kind of what we need to be doing for the long term to build the system we need. But just very quickly, a question that came in a bit earlier, and I think Ms. Kristiansen, you're the person to perhaps answer it, is someone mentioned that children and families of color are coming in as higher reports of child abuse and neglect. I'm curious, are those just being reported, or are they actually substantiated cases? So and the question is, do we have substantiated data that children of color are suffering higher rates of abuse, either pre-pandemic or during pandemic?
Nationally, we know that there are overrepresentation of children of color in our child welfare system. And so I do think that there's multiple questions there. Who's being reported and what does that look like? How do we screen those reports and what gets screened in? And then what do our substantiations look like? And I don't have all of that data, but I do think asking those questions and looking at those different pieces of the puzzle help us to begin to look at where are our disparities and how do we make better decisions for kids.
Okay. And do I understand correctly that the system that you use to both input information about cases and also to download reports about them it's not as user friendly and easy to access that kind of demographic distribution of your caseload? Right.
So, we may be putting information in, but not able to get all of it out in the way that we would like. And so data is a challenge. And we know that being able to truly understand where our disparities are and how do we improve our outcomes overall, we really have to have good data. And as a small county, there are things that sometimes we can actually hand count and look at. But there are other things that are just really difficult to be able to do and collect everything that you would want to really feel like you've got the information that you need to do the best job. And so, yes, data's definitely a challenge.
Okay. It's an opportunity for us to seize going forward.
Absolutely.
All right, well, let's look to the future. And I know, Ms. Hirsch, you started talking about this a bit earlier in the hour. But from your point of view, how do we best support children and families so that our rates of trauma, abuse, and neglect are driven as low as we possibly can?
Well, we really have to start by investing in them early. I know in the last couple of weeks you have talked about home visiting and parenting ed programs. We know home visiting programs are only reaching about 1% of babies across our state. We have an opportunity to increase that significantly in the next number of years, making sure that we have access to quality, affordable childcare. That's another key strategy that the Centers for Disease Control and Prevention talks about in preventing child maltreatment. And only about 25% of children in North Carolina are able to access quality, affordable childcare, particularly with subsidy and Smart Start. We have a really wonderful quality system, but it's not accessible, particularly to our youngest children. It's very hard to find infant care in many communities. Economic supports for families are also foundational. There have been multiple studies around not only the impact of paid family and medical leave, paid sick days, an earned income tax credit, and living wages all can make a difference for families. And our failure to invest early, and particularly to focus on financial security, can have an incredible positive benefit if we make those investments. My hope for the future is that we're all seeing this as the pandemic, peels back the layers of the onion around this. We're learning that the things that we have always known and the things that we've always advocated for in child advocacy circles, more people are seeing how foundational they are for all of us. So that's my hope, is that we'll think more strategically about why it's important for us to invest early in family, economic, and social supports.
And can I
add on to that?
Oh yeah, absolutely. Jump right in.
So, I agree with everything that Ms. Hirsch said. I did want to just highlight for listeners, there is an excellent hotline, because the need for childcare is so great, particularly for our younger children, where we know there's higher risk of abuse and neglect. The supervision of remote learning is that much harder the younger the child is, just because they need a lot more assistance than our middle and high school kids, who might be more independent on average. So the hotline number for listeners is 1-888-600-1685. And that's a hotline that parents can call to try to identify options for childcare for kids 12 and under. For parents who may not be aware, there are schools, even if they're remote learning schools, that are opening the schools up to allow children to safely remote learn within the school. There are many community-based organizations, childcare centers that typically take care of only pre-K through 12 age children, who are trying to be creative and come together as a community to really support families and children who really need that extra support. So I would add that. And then to add to what Ms. Hirsch said, I think what we can really do to prevent abuse and neglect and address some of these many inequities that we talked about is to get this pandemic under control. And that requires everyone in the community banding together, doing all the right things, wearing a mask, washing our hands, waiting 6 feet apart, the 3 W's, so that we can get that done. And then I will just make a plug for it. And we need to reopen our schools, again, particularly for our youngest learners, as soon as possible, because of all of the ramifications for our children academically, for families being able to return to work. The fact that schools provide many essential services beyond education, including nutrition, and, as we've been talking about today, a safe place for many children who don't have a safe alternative during the day.
And that hotline number for childcare is posted in the chat. Ms. Kristiansen, I saw you nodding your head as Ms. Hirsch was listing the things that we need to do. Anything more to add to that? I assume you agree?
I do agree. And I don't know. She said it very well.
Okay. Well, let's turn to Dr. Wong, because Dr. Wong, you are embarked, you and your colleagues have won one of 8 national grants from the federal government to do a pilot project to, I think, try and address or create the system that you think we need in order to truly drive down trauma and to treat it as it emerges. And I wonder if you could describe your project and what you hope to accomplish.
Yeah, thank you so much for the opportunity. Do we have the slide by chance that might be shown? Wonderful. So this particular project is called the North Carolina Integrated Care for Kids Model. As Pat mentioned, this is a federally funded project from the Center for Medicare and Medicaid Services. And within this project, our mission is to partner with communities to support and bridge services where children live, learn, and play. And what we're really trying to do within this model is trying to address things that have just been, as Ms. Hirsch and Ms. Kristiansen alluded to, address some of these inequities and challenges and issues that we see that have been thrown into even starker contrast because of the COVID-19 pandemic. So this is a child-centered model of coordinating not just the healthcare, I'm a primary care pediatrician, so we think a lot about the healthcare space, but also all the other social support services that children need. So that includes child welfare, juvenile justice. We're working closely with the schools, other early care and education settings like Smart Start and Head Start that were referred to earlier, food, housing, transportation. And one thing that makes this particular model very unique is that we have both the authority and the mandate to institute new ways for paying for this type of integrated cross-sector care. This is a project that is being led by 3 major institutions, though we have a coalition of hundreds of institutions, including the organization that Ms. Hirsch leads. So it's Duke University, University of North Carolina at Chapel Hill, and the North Carolina Department of Health and Human Services. We are in a planning phase now. We launched at the beginning of this year, and the actual model will go into effect or go live in 2022. This model is not across the entire state. It is being done in these 5 counties shown here on the slide. For those who aren't looking, it's Alamance, Orange, Durham, Granville, and Vance counties. And we are really thinking very hard right now because we just launched in January. The pandemic sort of hit us right as we were getting off the ground. And we're thinking about how we can really think about things like trauma and the inequities and the rise of virtual services and how that gets built into what we had already designed in thinking about how we bring these different sectors together to really promote children who are thriving where they live, learn, and play.
Can you say a word, just help us understand, what are you going to be doing differently as a result of your model compared to the way things happen right now?
Yeah, well, one of the things that, I think we see, and anyone who's working on the front lines with children and families see, is one wonderful thing is that we have actually many different agencies and services that are there to support children, and particularly safety net services for children. The challenge, however, is that often those different services are quite siloed. And even what we hear from families is that they know that there are many people out there who are trying to help them, but trying to put all those pieces together, or have a so-called quarterback who's helping a family put those pieces together, is often lacking. And so what we're trying to do within this model is to build infrastructure and capacity so that we have relationships and trust among our key stakeholders in these different sectors, and then are also building actual infrastructure, including the use of technology and people that we're hiring within this model to serve as that sort of interstitial tissue that's connecting folks, and using the technology so that when we're coming up with different, for example, shared action plans for a child who is touching many different systems, that type of plan and key information is available to all the stakeholders. Because as a primary care physician, for example, I have many children for whom I would love to know what's going on in school, and if they have had assessments at school, and sort of what their counselor at school is most focused on when I'm interacting with the child welfare system. I know that there's so much work that happens there. There are reasons that some of those data cannot be shared, of course, but thinking about what is possible. And then finally, we're also thinking about how do we have a more holistic picture of not just children, but their families. I think everyone on this panel today would agree the health and well-being of a child is very much influenced by the health and well-being of their family that's around them. The way that our system is currently set up does not often reflect that. And so we're bringing in data around caregivers and parents, linking that to their child so we can better understand if the child has a parent who is currently incarcerated or who is struggling with substance use disorder. That child, even though I might think looks fine developmentally, physically on the surface, we know that that child is at higher risk. And so going back to what Ms. Hirsch is saying about prevention, we're really thinking about trying to identify some of those other risk factors that right now we sometimes identify, but it's not a sort of systematic identification. So we'd like to identify that so that we know which children are at higher risk of falling what I call off track in their thriving, so that we can try to prevent that before it happens.
So if all goes well and you create and implement this system in those counties, if I'm a parent, a caregiver, or a child in those counties, how is my life going to be different in terms of interacting with any of those different groups that provide services? What will be different?
Yeah, the hope would be that because of the infrastructure and capacity that we're building, it will be perhaps for some families, I think for some families, and I see a comment here in the chat that's talking about the child care system of child and family team meetings. We are looking to build upon infrastructures exactly like that. We're not looking to duplicate anything, but as I'm sure many of the listeners and the panelists know, those different types of systems are not available to all children. And I should have mentioned, I'm sorry, I forgot to mention, this is for Medicaid and CHIP insured children who are in those counties. That was an important detail that I left out. We are looking to sort of build this infrastructure such that families who either have some of these systems in place, perhaps those systems will be able to more effectively work with, say, their child's school or their child's early care and education program, or more easily and seamlessly integrate and effectively work with the child welfare or juvenile justice system. And then we're also really emphasizing trying to identify those children and families who would really benefit from something like the system of child and family team meetings, for whom we have identified that they would really benefit from that, and to be able to help push that type of resource and structure to those families, because we know that there are some families who are really lacking that type of service. And then to do it again in this very integrated way, well outside of just the healthcare system.
So your target audience is low-income children and their families in these counties, and by and large. And so if I was in that population then, and this is up and running, do I understand correctly? It would mean, like, if I'm dealing with the school counselor, that counselor will have a much more holistic understanding of how my child is plugged into these other support structures in the community?
Yeah, that's right. So it's for any Medicaid and CHIP insured child in those 5 counties from birth all the way up to age 21. So it does include some of our young adults who are Medicaid insured, Medicaid and CHIP insured. And the goal would be that actually everyone who's interfacing with that child would have a more holistic sense of what's going on. What we're hearing from stakeholders is that often, and I'm sure Ms. Kristiansen and Ms. Hirsch could speak to this, is, a child comes into, contact with their system. Everyone tries to do as rapid assessments as we can, the same way we do clinically. But sometimes because of just the time frame in which things are happening and sort of the inability to connect with people who already know that child and family, you might only see a small part of what's going on in that child and family's life. It's one person made the metaphor of an elephant. You see like a very small part of the elephant, but there's actually a lot of other things going on, some of which are really more the root cause. I think, like Ms. Hirsch said, sometimes they're not needing child welfare. They just need some help to sort of get them back up on their feet, so that they can go on and help and promote the health and well-being of children. And then I'll just respond to a question I see here about working with county agencies. And we're working across these 5 counties with these agencies. I think if we can share my contact information, if you are interested in learning more, we would be very happy to connect with folks across any of these counties, or also organizations working across the state. We have already connected with Family Success Alliance quite closely, actually, which is, I see one thing mentioned in the chat. But again, we're very interested in engaging with stakeholders. And when we were putting this whole model together, this is how partly how Ms. Hirsch and I met. We talked to so many people across the state who were very interested in this model, because it sort of brings together all these systems, and then importantly actually changes the way that the systems are paid, which is something that is very unique in this particular award compared to some other grant-funded programs.
Got it. Wonderful. All right. Well, we are just about out of time here. I'm going to give each of you one short moment to say to share any final thoughts before we close. Ms. Hirsch?
I just wanted to thank you for the opportunity to do this and to be able to spread this message that is really important that we invest early in families. This has been a great opportunity, so thank you.
Thank you. Ms. Kristiansen?
Yes, I agree. This has been a wonderful discussion, and we, see how the investments that Ms. Hirsch is talking about could really make an impact on the families that we serve. And so projects like Dr. Wong really start to get at those issues, and really excited to see what that holds for our state.
Dr. Wong, any final thoughts?
Yeah, I'll just add thanks for the opportunity. I would just really implore all of the listeners to advocate for putting children first, number one. Number two, tamp down on this pandemic, because if the faster we get this controlled, the better it will be for children. That will be putting children first by tamping down on this pandemic. And third, to, like Ms. Hirsch said earlier, to reach out, be a good neighbor, be a good citizen, look for children and families who are in need, and do what part you can to help alleviate some of that stress that they're experiencing.
Very good. All right. Well, as we close, let me note that we as an organization are committed to engaging a diverse and representative audience in our work across the state. And we would be grateful if you could spare 1 minute to fill out a very short multiple choice survey to capture audience demographics. And that should be popping up on your screen right now if you are on Zoom. If you're on Facebook, you should see a link to that survey. And again, please take just a moment to fill that out. That's our show for today. If there's one thing that sticks out to me from today's conversation, it's the immense cost of trauma to those who experience it and to all of us who are paying in and year out for its impacts in one way or another. I think I've come away convinced that going all in on prevention makes a lot of sense. And so I'm going to be watching eagerly to see what happens in those 5 counties with Dr. Wong's initiative. My thanks to today's guests, Sharon Hirsch, Jennie Kristiansen, and Dr. Charlene Wong. If you enjoyed today's show and you're interested in sharing this episode, please check out our website, emergingissues.org/podcast, where we will be posting a recording of this show by noon tomorrow. You'll also find our slides and also links to supporting resources. Again, that's emergingissues.org/podcast. And let me also thank the Duke Endowment for sponsoring this series. Leslie Boney will be back on September 10th with our next Zoomcast, COVID and Confinement. What are we learning about limiting the spread of the virus in prisons and nursing homes? All right, First and Future is produced by Greg Hedgepath and James Herrick. Kirsten Chang gets the word out and keeps our chat going. Simone Coleman does our research, and Renee Potts creates our slides. My thanks to all of them, and to all of you. Stay safe and see you in the future.